Mr. Thomas. My name is Esther Thomas, a nursing student of West Coast University. I'm here to do an assessment of head to toe. First of all, Mr. Thomas, I'm going to bring the bed up to a comfortable level. I will close the curtain for privacy. And now I will go ahead and do hand hygiene and put on my gloves. Before we go ahead, Mr. Thomas, I have some few questions to ask you. Can you verify your full name, date of birth? Okay, thank you. Mr. Thomas, do you have any allergy, any pain? If patient is having pain, I will do the old cat eyes method. So, another few questions, Mr. Thomas. Do you know which day is today? Do you know why you're in the hospital? You know which city you live in? Are you married? Do you have any children, grandchildren? Do you live by yourself or with a family member? Do you smoke, drink alcohol, substance abuse? Okay, I will go ahead now and proceed with the assessment. First, I will assess the patient head, inspect. The head is round, hard, any pain, tenderness, hair distribution is even. Now I will go ahead and assess patient lymph nodes. I should not palpate it from preauricular, postauricular, occipital, submandibular, submental, anterior cervical, posterior cervical, supraclavicle. And since I'm here, I'm going to assess for patient skin toggle. Skin did not tint, so patient is hydrated. I will go ahead and assess patient eyes for reaction. Patient pupil is around 3 millimeters and the eyes reacted to light. Please follow this the pen with your eyes. I'm assessing for accommodation. I accommodated, and now I'm going to assess for the 6 field of gaze. Follow the pen with your eyes, not with your head. Cranial nerve 6 is intact. From this position, I will assess patient ears. Inspect, ears are in position, bilateral. Do you have any pain, any tenderness? Now I will look. No drainage, no obstruction, no bleeding. No drainage, no obstruction, no bleeding. Now I will assess patient's nose. Nose is in midline. No bleeding, no obstruction. Septal is in midline, it's not deviated. I will go ahead and assess patient mouth. Can you open your mouth for me? Say ah. Uvula is in midline, gag reflex, mucosa is pinkish, moist. Stick your tongue out, side to side. Cranial nerve 12 is intact. Swallow. Okay, now I will go ahead and assess patient's arms. Skin is even and uniform according to patient ethnicity. Hair distribution is normal. I will assess the skin of the elbow. No skin breakdown. Full range of motion. Touch my hands. Patient grip is bilateral, equal in both hands. I will assess for capillary fill. Capillary fill. Less than 3 seconds. And now I will listen to assess for patient pulse. The pulse can be here, strong, 2 plus. Okay, thank you. I'm going to go ahead now and assess our patient's heart. Oh, sorry. I'm going to assess your cardiac. Starting from the right clavicle, right intercostal space, mid clavicle is aortic. On the left side is pulmonic, second intercostal, third intercostal is L point, fourth intercostal is tricuspid by the sternum border, fifth intercostal mid clavicle is the mitral. I will listen that with the bell, and I will listen for this for a whole minute. "95 beats per minute." I'm going to go ahead now and assess your anterior lungs. Mr. Thomas, every time I press the stethoscope in your skin, you take a deep breath. If you get tired, you let me know and we take a break. Before I start, I continue. Do you have any cough? No cough. And if patients say they have cough, I will want to know if the cough is productive. If it's productive, if they bring anything up, which color is the spot on, and consistency. So, again, patient skin is even, no discoloration, breathing is even. So I will start. I will assess in 4 places, side to side. Patient chest is normal, is expanding, chest raise up symmetrically. No crackles, no wheezes, no ronchi. Can you please sit up? Yes. Okay. The same, every time I put the stethoscope, you take a deep breath. Patient's skin is smooth and the color is even, and the chest expansion is normal. So I will assess in 8 places, starting from the left, side by side. Taking a deep breath. Thank you. Thank you. So I'm going to go ahead now and uncover your abdomen. Mr. Thomas, when was the last time you used the bathroom? Okay, and upon urination, do you have any sensation of burning, or your pee have a full odor? Okay, so I will start inspect. The belly is flat, no hernia. Here distribution is even, no sign of discomfort. So I will start with auscultating from the lower right quadrant, upper right quadrant, upper left quadrant, upper lower quadrant, left lower quadrant, and the sound is hyperactive goggling. Now I will percuss from the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, and the sound is tympani. I will go ahead now and palpate. Light palpation, upper right, upper left, lower left, Patient abdomen is soft, so no sign of distension. I will assess patient feet now. Mr. Thomas, I'm going to uncover your feet. Patient's skin is even. Hair distribution is normal. Patient's legs are warm to touch. No pitting edema. No sign of DVT. Can you please push your feet against my hands? Patient's legs have the strength in both legs. I'm going to assess for dorsal pedis. Okay, it's a 2 plus, and posterior tibial. Okay, also +2. Capillary refill on the 2 feet is 3 minus 3 seconds. I'm going to assess for the heels, for skin breakdown. No skin breakdown in the feet. That was all. So now, Mr. Thomas, I finished with the assessment. I will clean my hand again. Bring your bed to the lowest position and put the cold light by your side. Open the curtain. And Mr. Thomas, is there anything you want me to do before I leave the room? If there is nothing, I'm leaving now, but for any reason, if you need something, you press the call button and somebody will be with you. Thank you very much for your time. I will give the result to the doctor and he will be the one talking to you. Thank you and bye.